We're students in the same 10th grade English class at Lycée in Paris, located in the 5th arrondissement. Academically, it's one of the top schools in France.
We don't do much community service. That's why we're so excited to get a chance to participate in the Tiltshift 2011 project.
We decided to attack some of the healthcare problems, especially for the unprivileged.
But you know, France has always been considered one of the best countries in the world for medical care and health insurance.
It's true. We have a universal health coverage called CMU, which ensures health care to anyone living in France who doesn't already have coverage through his job. It was a law passed in 1999 by Jospin's government.
Theoretically, everyone can have access to it. Anyone living in France in a regular legal situation.
That's what Obama spent his first 2 years term trying to do.
But putting the law into practice is the problem.
Not everyone is in a regular situation. Some travel too much to belong to any country. Some are illegal immigrants.
Which doesn't mean they don't have a right to adequate medical care.
Another problem is that many people don't actually know about the CMU, and you have to ask for it to get it. So among the 6 million people who could benefit from the CMU, over a third do not. And when they do have access to it, some doctors even refuse to treat them.
There's a real need for action here, even in the well-off neighborhoods of Paris. It's hard to see the great number of people who are living in the streets and not treated properly, and to know that they could be with just a little help.
Our first goal is to make sure that everyone can have access to adequate information. To do this, our first step will be to design a leaflet and have it translated into several different languages to tell people what rights they have concerning health insurance.
But what can we do to help in the long term, to make any kind of difference? Yourself, you told me about PASS. What is it exactly?
It stands for Permanent Access to Healthcare and is the hospital's effort to put into practice universal coverage. It's a service adapted to those who are in precarious situations.
So what can we do to help them?
I had an idea. Tell me what you think about it. I imagine when a foreigner goes to the emergency room of a hospital, if he or she doesn't speak French, he might have problems explaining what's wrong with him. What if we started an association of students who speak fluently several languages to serve as interpreters?
Do you think other high schools in the 5th would be interested?
I'm sure they would. Maybe go talk to the social services of the municipality of the 5th and to the personnel of neighborhood hospitals that have PASS centers. I know that the Salpêtrière has a big one. There's also Hôtel Dieu and Hôtel Cochin. And go meet the volunteer associations already in place, like Atelier Santé Ville Paris and Médecins du Monde, to get some advice.
Okay, we can do that.